Good day, everyone. So we are the breast cancer awareness advocacy group. Our group name is Women Bleed Pink, a breast cancer awareness advocacy. And for today's health information campaign, we're going to talk about breast cancer and everything related to it. So without further ado, let's proceed with the discussion. So next slide, please. So here is our motto for the advocacy: feel for lumps, save your bumps. And these here are my group mates. Starting from the far left, we have Miss Sarah May Candaleza. We have Miss Angelique Cuesta. We have Sarah Del Castillo, and yours truly, Gian Rainier Dino. We also have Miss Jessa May Felisco. We also have Jonah Chris El Carte, and we also have Kimel Ann Dayondon. So next slide, please. So for our discussion today, we're going to tackle the introduction and the risk factors as well, the signs and symptoms of breast cancer, how to prevent breast cancer, and how to treat breast cancer. And we're also going to talk about the facts and myths about breast cancer. So let's proceed with the introduction. Okay. So what is breast cancer? So breast cancer is a disease in which cells in the breast grow out of control. So there are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. So breast cancer simply means simply put it, cancer in the breast, and uh, we will discuss it further because there are different parts of the breast, and each part may have a abnormality in dividing, and which will cause further complications such as tumors, or if the tumor will become malignant, it will turn into breast cancer. Okay, so next slide, please. Okay, so did you know that 1 in 8 women 1 in 8 women in the US will develop breast cancer in her lifetime? Okay, so next slide, please. So statistics in the breast cancer in the Philippines. So breast cancer is the most common cancer amongst women in the Philippines. And according to the Philippine Statistics of Authority and the Department of Health, it shows that 3 in every 100 Filipino women will be diagnosed with breast cancer in their lifetime. And the Philippines had the highest prevalence of breast cancer from among 197 countries in February 2017, which is according to the Philippine Obstetrical and Gynecological Society. Okay, next slide. So we have data from the breast cancer around the world. So for the countries with the highest high death rates of breast cancer, I only picked the top 3. But in this certain source, we have top 10. But I just included the top 3. We have for the countries with high death rates, we have Barbados, we have Fiji, and also Jamaica. While countries that has high incidence rates of breast cancer, we have Belgium, Netherlands, and Luxembourg. Okay, so next slide, please. Okay, so we have before we go on deeper, we have to understand the concepts. Okay, so we have to also discuss the structure of the breast. Okay, so the female breast is mostly made up of a collection of fat cells called adipose tissue, which extends from the collarbone down to the underarm and across to the middle of the rib cage. And a healthy female breast is made up of 12 to 20 sections called lobes. And each of these lobes is made up of many smaller lobules, the gland that produces milk in nursing women. They are connected by milk ducts, which act as stems or tubes to carry the milk to the nipple. Next slide, please. Okay, so Another topic is, does breast cancer affect men? Okay, so all people, whether male or female, are born with some breast cells and tissue. And even though males do not develop milk-producing breasts, a man's breast cells and tissue can still develop cancer. And even so, male breast cancer is very rare. Less than 1% of all breast cancer cases develop in men, and only 1 in 1,000 men will ever be diagnosed with breast cancer. Okay, so let's rule out that misconception na men will not be affected by breast cancer and only women, because um, although men do not develop or produce milk, but still most of the structure of the breast of the men and women are similar, and complications can happen with men as well that can lead to breast cancer. Okay, so next slide, please. Okay, so we have here another set of data, no? So for 40 plus, above 40 years old is the most common age for breast cancer in women, and 2.6%, that is the percentage which indicates the mortality rate of breast cancer. Okay, so next slide, please. So we have here so for the breast cancer, for women who are diagnosed with breast cancer, uh, be strong and fight on. Okay. Okay, so now we have the prognosis of breast cancer.
So, I'm going to discuss about the prognosis of breast cancer. So these are the common types of breast cancer. First is the ductal carcinoma in situ or DCIS. Next is the invasive ductal carcinoma or the IDC. Uh, the third one is the lobular carcinoma in situ or the LCIS, and the last one is the invasive lobular carcinoma ILC. So next slide. So first is the ductal carcinoma in situ. So the abnormal and malignant cells in the ducts have not migrated into neighboring breast tissue or elsewhere, such as the lymph node. So this is the common type of breast cancer. So next slide please. Uh, Next is the invasive ductal carcinoma. So, invasive ductal carcinoma occurs when cancer spreads from a milk duct to adjacent tissue and lymph nodes. It may then spread to other parts of the body, such as the bones and distant organs, or metastasize. Cancerous cells migrate and spread through the lymph system, which is part of the immune system or bloodstream. So the next type of breast cancer is, next slide, the lobular carcinoma in situ. So the LCIS or the lobular carcinoma is not technically cancer, but rather an alteration in the breast. So tens of thousands of small clusters of lobules generate breast milk in the breast. Inside these lobules, cells that resemble cancer cells may proliferate, and it has a tendency to stay put and not spread. So the last one is the invasive lobular carcinoma. So this cancer starts in the breast milk producing glands, which are called lobules and may spread to other parts of the body. So those are the common types of the breast cancer. So next is the stages of breast cancer. So next slide. So the stages are the number 0 and the Roman numerals 1, 2, 3, or 4, often followed by A, B, or C. So in general, the higher the number, the more advanced the cancer. So stage 0, so the cancer has been diagnosed early. So it started in the breast ducts or milk glands and has stayed there. Uh, for the stage 1, Starting at this level, breast cancer is called invasive, meaning it has broken free to attack healthy tissue. So, under that, the stage 1A means the cancer has spread into the fatty breast tissue. The tumor itself is no longer than a shield peanut, or there may be no tumor. For the stage 1B, so it means that some cancer cells, but just tiny amounts, have been found in a few lymph nodes. So next is the stage 2. So the cancer has grown, spread, or both. So stage 2A means the tumor in the breast still small, if there's one at all. There may be no cancer in the lymph nodes, or it may have spread to as many as 3. So a stage 2B breast tumor is bigger. It may be the size of a walnut or as big as a lime. It may not be in any lymph nodes. So next is the stage 3. So the cancer has not spread to bones or organs, but it is considered advanced and it is harder to fight. So the stage 3A means the cancer has been found in up to 9 of the lymph nodes that form a chain rather from your underarm to your collarbone, or it has spread to or enlarged the lymph nodes deep in your breast. In some cases, there is a large tumor in the breast, but other times there is no tumor. So the 3B, the stage 3B means the tumor has grown into the chest wall or skin around your breast, even if it hasn't spread to the lymph nodes. So next is the stage 3C, means cancer has been found in 10 or more lymph nodes or has spread above or below your collarbone. It's also 3C if your lymph nodes outside the breast are affected, but those inside it are enlarged or cancerous. So the last one is the stage 4. So breast cancer cells have spread far away from the breast and lymph nodes are right around it. The most common sites are the bones, lungs, liver, and brain. This stage is described as metastatic, meaning it has spread beyond the region of the body where it was first found. So that's it for the stages of breast cancer.
Okay, so let's now move to risk factors of breast cancer. So, a risk factor is anything that increases your chances of getting a disease such as breast cancer. But having a risk factor even even any many does not mean that you sure to get the disease. So, certain breast cancer risk factors are related to personal behaviors such as diet and physical activity. So, the first risk factor that you can control is keep your weight in check. So, overweight and obese women defined as having a BMI or the body mass index over 25. So, it has a higher risk of being diagnosed with breast cancer compared to women who maintain a healthy weight, especially after menopause. So, this higher risk is because the fat cells make estrogen, and as extra fat cells mean more estrogen in the body. And estrogen can make hormone receptor positive breast cancer develop and grow. So by keeping your weight in check, it is a way to have the power over your health. So the second risk factor that you can control is eat right and exercise. So diet is thought to be the least partly responsible for about 30% to 40% of all types of cancers. So no food or diet can prevent you from getting breast cancer. But some food can make your body the healthiest it can be, boost your immune system, and help keep your risk for breast cancer as low as possible. So research has shown that getting the nutrients you need from a variety of food, if especially fruits, Now, especially vegetables, legumes, and whole grains can make you feel your best and give your body that um, and give your body the energy it needs. So, um, eating foods grown without pesticides may protect you against unhealthy cells changes associated with pesticides used in animal studies. Also, engaging in regular physical activity is associated with reduced breast cancer risk and is one way to help you promote a healthy body weight. So, the third, breast cancer screening. So, breast cancer screening includes regular mammogram and breast self exam. Early detection saves lives. So, for many women, mammograms are the best way to find breast cancer early when it is easier to treat and before it is big enough to feel or cause some symptoms. So, having a regular mammogram can lower the risk of dying from breast cancer. Okay, so let's now move to the next. Okay, monitor lifestyle choices. So as you can see um, in the right corner, so we have here smoking. So cigarette smoke contains toxins, including the cancer-causing chemicals. So, women who smoke or used to smoke are more likely to get breast cancer than those women or men who don't or never did. So, also, smoking raises your chances of dying of breast cancer after your diagnosis, and it makes the cancer more likely to come back. Research also shown that there may be link between heavy secondhand smoke exposure and breast cancer risk in postmenopausal women. Okay, next, the drinking alcohol. So, drinking alcohol is clearly linked to an increased risk of breast cancer. So, the risk increases with the amount of alcohol consumed. So, women and men who have one alcohol drink a day have a small for like about 7% to 10% increase in risk compared with those who don't drink. So um, while those who have 2 to 3 drinks a day have about 20% higher risk. So alcohol also linked to an increased risk of other types of cancer too. So alcohol can increase the level of estrogen and other hormones associated with hormone receptor positive breast cancer. Also, alcohol also may increase the breast cancer risk by damaging the DNA cells. Okay, so getting enough sleep, eating a healthy diet, being physically active, maintaining a healthy body weight, not smoking, and limit alcohol are some ways in monitoring lifestyle choices and reduce the risk of getting breast cancer. Okay, so let's now discuss the factor you cannot control. So menstruating before age 11. So the earlier a woman starts having period, the longer her breast tissue is exposed to estrogen released during the menstrual cycle. So this means that the higher or the greater lifetime exposure to estrogen, so the greater exposure to estrogen, the greater the risk. So it is a good idea that all young girls to be physically active and not to be overweight. However, it is not recommended um, girls do anything to change when they start their getting their period. Okay, starting menopause later in life. So the longer a woman menstruate, the higher her lifetime exposure to the hormones estrogen and progesterone. So the higher risk of breast cancer. Next, undergoing hormone replacement therapy or the HRT. So this HRT is a treatment to help with menopausal symptoms. So it increases the level of hormones in the body that naturally reduce during the menopause. For some women, this treatment, this therapy can vastly improve quality of life, and the risk of taking it needs to be balanced against the benefits. So the research suggests that this is due to the higher level of estrogen. So, so some breast cancers can use estrogen to help them uh, can help them to grow. So there are also some factors that can influence the risk of breast cancer. For like example, how long you take your HRT for. So the longer you use the hormone replacement therapy, the greater the risk. So next slide, please. Okay. So lastly, so not having children or breastfeeding before age 30. So when breast cells are made in adolescence, they are immature and very active um, until your first full term pregnancy. So the immature breast cells respond to the hormone estrogen as well as to the hormone disrupting chemicals in product. So your first full term pregnancy makes the breast cell fully mature and grow in a more regular way. So this is the main reason why pregnancy helps protect against breast cancer. Also, breastfeeding can lower the breast cancer risk, especially if a woman breastfeed for longer than 1 year. So there are several reasons why breastfeeding protects breast health. So this includes breastfeeding, it makes milk 24/7. It limits breast cells' ability to misbehave. Also, some women have a fewer menstrual cycles when they are breastfeeding, so added to the 9 months period during pregnancy, resulting in low estrogen levels. Lastly, many women tend to eat more nutritious food and follow their healthier lifestyle. No, it includes limit smoking and alcohol use while breastfeeding. Okay, so whether or not you have children at younger age, there are lifestyle choices you can make to keep your breast cancer risk as low as it can be. So it includes what I have mentioned, maintaining a healthy weight, exercising regularly, limiting alcohol, eating nutritious food, never smoking or quitting if you do smoke. Okay. So none of these factors will automatically cause breast cancer, but we can consider them clues about the patient's specific cancer diagnosis. Okay. Next slide, please. Fact time. Okay, so did you know lesbian and bisexual women tend to have an increased risk of breast cancer? No, studies show that the increased risk of breast cancer is linked to increased factors that tend to be more common in lesbians, such as never having children or having them later in life, obesity, and alcohol use. Okay,
Okay, so now for the signs and symptoms of breast cancer. Next slide, please. Okay, so different people have different symptoms of breast cancer. So some people do not have any signs or symptoms at all. So some warning signs of breast cancer are first, a new lump in the breast or underarm or the armpit. So breast cancer is most often associated with having a breast lump. However, symptoms may vary depending on the specific type of breast cancer. So it is true that many breast cancer patients have a lump, but not all of them will. So that is why it is important to know the other signs and symptoms. Next is the thickening or swelling of part of the breast. So most fibrocystic breast changes are normal. So fibrocystic breast happens when women develop fluid-filled cysts along with the area of fibrosis in one or both breasts. So, however, make an appointment with your doctor if you find a new or persistent breast lump or area of permanent thickening or firmness of the breast tissue. Next is the irritation or dimpling of breast skin.
So dimpling of breast causes the skin to look like the pitting and uneven skin of an orange. Sometimes the skin may look red and inflamed. So next is redness or flaky skin in the nipple area or the breast. So it is important to remember that other benign conditions may have caused these changes. So for example, changes to the skin texture on the breast may be caused by a skin condition like eczema, and swollen lymph nodes may be caused by an infection in the breast or other unrelated illness. That's why seeing a doctor for an evaluation will help determine whether something you notice is cause for concern. Next is, next is pulling in of the nipple or pain in the nipple area. So nipple retraction and skin retraction might be normal if it has been present for several years. But recent onset skin or nipple retraction is more suspicious of a possible cancer. Next is nipple discharge other than breast milk, including blood. So nipple discharge is any fluid or other liquid that comes out of your nipple. It is common during reproductive years, even if you're not pregnant or breastfeeding. So discharge is usually not serious, but still it can be a sign of breast cancer. So if you do have breast cancer, the discharge will probably only come from one breast. Next is any change in the size or the shape of the breast. So a change in breast shape does not always mean you have a cancer. Most women have changes in their breasts during their lifetime. So many of these changes are caused by hormones, but any change in the appearance rather or feel of your breasts should always be investigated. And lastly, pain in any area of the breast. So keep in mind that these symptoms can happen with other conditions that are not cancer. So that is it for the signs and symptoms.
So now let's proceed with the diagnosis. So when we say wait for a while. When we say diagnosis, it is the process of determining which disease or condition explains a person's symptoms or signs. So next, the tests and procedures used to diagnose breast cancer include the following: the breast exam, which the doctor will check both of your breasts and lymph nodes in your armpit, feeling for any lumps or other abnormalities. Next, we have here the mammogram, which is an X-ray of the breast. So these are commonly used to screen breast cancer. If abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic mammogram to further evaluate the abnormality. Next, we have the breast ultrasound. So we know that ultrasound uses sound waves to produce images of the structures deep within the body. Ultrasound may be used to determine whether a new breast lump is a solid mass or a fluid-filled cyst. Next, we have the remove. Next, we have the removing a sample of breast cells for testing or the biopsy. A biopsy is the only definitive way to make a diagnosis of breast cancer. During a biopsy, your doctor uses a specialized needle device guided by X-ray or another imaging test to extract a core of tissue from the suspicious area. Often, a small metal marker is left at the site within your breast so the area can be easily identified on future imaging tests. Next is we have the um, breast magnetic resonance imaging or the MRI. So an MRI machine uses a magnet and radio waves to create pictures of the interior of your breast. Before a breast MRI, you receive an injection of dye. Unlike other types of imaging tests, an MRI doesn't use radiation to create the images. So now let's proceed to the next slide, which will tackle about the prevention. So next, so we knew that early detection can save lives. So next, so the breast cancer prevention includes the limit alcohol. So It was tackled earlier on the risk factors that the more alcohol you drink, the greater your risk of developing breast cancer. Now we must maintain a healthy weight because if your weight is healthy, work to maintain that weight. If you need to lose weight, ask your doctor about healthy strategies to accomplish this. Reduce the number of calories you eat each day and slowly increase the amount of exercise. So next we have the exercise. So be physically active. Most healthy adults should aim for at least 115 minutes a week or moderate aerobic activity or 75 minutes of vigorous aerobic activity weekly, plus strength training at least twice a week. Next, we have here the breastfeed. So breastfeeding might play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. Next, we have here the good diet. So we must stay hydrated, get enough calories, focus on nutrients, and get the most nutrients per calories, and choose foods from the food groups. So things like the fruits, vegetables, grains, beans, nuts, seeds, meats or eggs, and dairy products. And protein helps. So we know that protein helps maintain lean body mass or muscle, and it was tackled also earlier that this will help us prevent the develop of breast cancer. And lastly, we have here the avoid menopausal hormone therapy or limit postmenopausal hormone therapy because combination hormone therapy may increase the risk of breast cancer. Talk with your doctor about the risks and benefits of hormone therapy. You might be able to manage your symptoms with non-hormonal therapies and medications. So next, um, another prevention for breast cancer is for self-examination. So steps for breast self-examinations. Look at your breast in the mirror. First, look at that with your arms by your side. Next, raise your arms and look at your breast closely again. This is the easiest way to see if something looks wrong or different. Next, examine your nipples and surrounding skin closely. If you see any changes such as dimpling, the puckering, redness, a change in your nipple, or anything coming out of them, and you're not breastfeeding, schedule a visit with your doctor. Next, in sitting position, use the pads of the three middle fingers using light, medium, and deep pressure. So examining the start at the collarbone and continues down and up the entire back in vertical pattern. So position yourself in bed, excuse me, which leads to a more even distribution of your breast tissue. So feel your breast while lying down. Use the opposite hand to examine each breast by feeling the breast tissue systematically with three figurative pads. Use circular motion, pressing firmly and covering entire area of the breast from outer armpits to the nipples across the space in between your breast and vertically from your collarbone to below the breasts. So that's it. Now let's proceed to the next slide.
Okay, so now moving on to the treatment. So, given that you develop breast cancer, there is still hope using these different types of treatments. So, first, so the goal of breast cancer treatment is number one is to eliminate the cancer cells in the body. This is to reduce the reoccurrence of the disease. The second is to prevent the recurrence of cancer, which basically means that help the breast cancer cells not to occur again. Okay. Now moving on to the breast cancer treatment options, we have the radiation therapy, we have the surgery, the immunotherapy, the targeted therapy, chemotherapy, and the hormone therapy. We also have the complementary methods, acupuncture, meditation, and healthy diet. Okay, first for the radiation therapy. So radiation therapy, this is using a high energy rays similar to X-ray to kill the cancer cells. So almost all the stages of breast cancer which has been discussed can be treated with the radiation treatment. It can help lower your chances of breast cancer recurrence following the surgery. It can also be widely used to alleviate the symptoms of cancers that spread to other places of your body or the metastatic breast cancer. So the radiation therapy can be delivered into types. We have the external radiation, which puts a deliver radiation from your body to the breast. So this is the most common type of radiation therapy. Second, we have the internal radiation, which is after your surgery to remove the cancer, your doctor will temporarily place radiation delivery device in your breast in the area where cancer was so once had. So a radiation source is placed into the device for short periods of time over the course of your treatment. Okay, so the second option, we have the surgery. So the surgery is only the cancerous or the two types of surgery to remove the cancer tissues. So first, the cancerous portion of your breast is removed during the lumpectomy procedure. This is also called the breast conserving surgery, where the only or the part of the breast which has a cancer will be removed. And then the second, we have the mastectomy, which is that your entire breast will be removed during this type of surgery. So, so you may ask, which is safer in the two procedure, no, lumpectomy or the mastectomy. So both procedures are effective treatments for breast cancers. However, the research shows that there is no difference in survival rate from either the procedure. So, though the lumpectomy has a slightly higher risk of reoccurrence of cancer, since your cancer, the only thing that will be removed is the affected part of your breast and not the entire breast. Okay, so next option, we have the immunotherapy. This target the cells by utilizing your own immune system. So this is to treat the triple negative breast cancer that has spread. The medication at atezolizumab and saxitizumab, govitecan, and they have been approved. So immunotherapy basically use your own immune system to attack cancer cells. So this aids in the battle against infection and other disorders. It is made up of white blood cells as well as the lymphatic organs and tissues. And the immunotherapy is basically a biological treatment since your own immune system is used. So what are the survival rate of immunotherapy? So 15 to 20% of patients achieve durable results with immunotherapy. Okay. Next option, we have the targeted therapy. So we have targeted therapy is uses drugs that blocks the growth of breast cancer cells in specific ways. There are two main groups of targeted therapy drugs that are monoclonal antibodies and small molecule inhibitors. So pamtras, pramtrazozumab and deroxtecan, uh, lapatinib and pertuzumab and the trastuzumab trigger your body's immune system to help destroy cancer cells. So these drugs are approved and are used during the targeted therapy. So you may ask as well if targeted therapy is better than chemotherapy. So targeted therapy is less toxic to the healthy cells than the chemo. Both options are done in conjunction with other treatments such as radiation, and both chemotherapy and targeted therapy are the types of cancer treatments that are both effective. Okay, next we have one of the common types of treatment. We have the chemotherapy. So chemotherapy uses drugs to kill cells or cancer cells. You take the medicines as pills or through an IV. Most people get it after surgery to kill any cancer cells left behind. Doctors also prescribe it before surgery to make the tumors smaller. So the survival rate of or the success rate of chemotherapy is that 98.1% of those who had chemo uh, are are survived or successfully fought cancer. So we also have, since chemotherapy is invasive, no, so we have a long-term side effects that we need to take into consideration. We have fatigue, headache, pain, dental issues, musculoskeletal symptoms, the bone loss, and heart problems. So we can also not recommend chemotherapy for those people who do not have healthy body or healthy lifestyle, not to withstand the chemotherapy. Maybe there is a more effective treatment for them available, because chemotherapy very um, has invasive or has a side effects that some women or some people cannot withstand. Okay, so we have next the hormone therapy. So it uses drugs as well to prevent the hormones, especially the estrogen, from fueling the growth of the breast cancer cells. They block hormone actions or lower the hormone levels in the blood. So what are the risks of hormone therapy? So these hormone therapy treatments can have a varying side effect and level of effectiveness in treating cancer, particularly depending on the age of the woman. So the good news is that there are many hormones therapy that are option or have option for hormone sensitive breast cancer. So you need to consult your doctor for this one. So what are the success rate of hormone therapy? 100% survival rate at 6 years as opposed to 87 in non-users. So both groups of tumors were detected by screening, thus detected early by a current convention. So hormone therapy is widely used because of its effectiveness. So next, we also have the complementary options. So we have the acupuncture, which may help breast cancer patient with treatment-related joint pain. Meditation appear to be able to better the management of fatigue, worry, fear, or recurrence of breast cancer patients. Yoga has been demonstrated to reduce fatigue, enhance sleep quality, and increase overall quality of life. Lastly, we have diet, as mentioned earlier, has been shown to have a range health of benefits that can all help you treat and recover from breast cancer. So you may also ask, how do I know which breast cancer treatment to choose? Firstly, you have to consider many factor. First is what's your or the cancer type of breast cancer type, which has been you are diagnosed. So second, we have the stage of the disease, refers to the size of your tumor and how far the cancer has gone throughout your body. And third, we have each treatment has risk and advantages as well as its adverse effect. So this can be discussed with your doctor. So before making your decision in what treatment or option to make, you have to consider your breast cancer type, what stage you are, and of course, you have to take into consideration if you can handle the risk and disadvantages of the treatment. Okay, moving on to the facts and myths.
Um, Good afternoon, everyone. So next is we have the facts versus myths. So here, we will tackle the misconceptions about breast cancer and the facts behind them. Okay, next slide, please. So the first myth, breast cancer always causes a lump you can feel. So for the fact, a breast cancer might not cause a lump, especially when it first develops. So people are sometimes under the impression that breast cancer always causes a lump that can be felt during a self-exam. So they might use this as a reason to skip mammograms, thinking they'll be able to feel any change that might indicate a problem. However, breast cancer doesn't always cause a lump. By the time it does, the cancer might have already moved beyond the breast into the lymph nodes. Although performing breast self-exam is certainly a good idea, it isn't a substitute for regular screening with mammography. Next slide. Okay. Next myth is men do not get breast cancer, so it affects women only. In fact, men also get breast cancer, so each year it is estimated that approximately 2,190 men will be diagnosed with breast cancer, and 410 will die. So while this percentage is still small, men should also check themselves periodically by doing a great self-exam while in the shower and reporting any changes to their physician. Okay. With another myth, mammogram can cause breast cancer to spread. So for the fact, breast compression while getting a mammogram cannot cause cancer to spread. So according to the National Cancer Institute, the benefits of mammography, however, nearly always outweigh the potential harm from the radiation exposure. Mammograms require very small doses of radiation. So the risk of harm from this radiation exposure is extremely low. That's right. Next is for the myth, if you have a family history of breast cancer, you're likely to develop breast cancer too. So fact, most people diagnosed with breast cancer have no known family history. So only about 5 to 10% of breast cancers are believed to be hereditary. So meaning they're caused by abnormal changes or mutations in certain genes passed from parent to child. So the vast majority of people who get breast cancer have no family history, suggesting that other factors must be at work, such as environment and lifestyle. So still, if you have a strong family history of breast cancer, you should it's either on your father's or mother's side. This is an important risk factor. So if there is one or more cases of breast cancer in close blood relatives before 50, share this information with your doctor. Okay, next slide. Okay, for the myth, antiperspirants and deodorants can cause breast cancer. To the fact, there is no evidence of a connection between underarm antiperspirant and breast cancer, but the safety of antiperspirants is still being studied. So researchers at the National Cancer Institute are not aware of any conclusive evidence linking the use of underarm antiperspirants of deodorants and the subsequent development of breast cancer. So still some studies have found that women who use aluminum products under their arms are more likely to have higher concentrations of aluminum in breast tissue. That's right. Okay. For the myth, this is one of the most famous myth about breast cancer. So wearing a bra can cause breast cancer. For the fact there is no evidence that bras cause breast cancer. So the theory was that wearing a bra, especially an underwire style, could restrict the flow of lymph fluid out of the breast, causing toxic substances to build up in the tissue. However, there is no evidence to support this claim. So a 2014 study of roughly 1,500 women with breast cancer found no link between bra wearing and breast cancer. Okay, next slide. So, next myth, carrying your cell phone in your bra can cause breast cancer. For the fact, there is no evidence of a connection between cell phones and breast cancer, but the safety of cell phones is still being studied. So, cell phone manufacturers often do recommend keeping your device away from your body as much as possible. Although there is no proven breast cancer link, you may wish to avoid wearing your cell phone in your bra or chest pocket until more research is available. Next slide. Okay, lastly, myth, breast cancer only happens to middle-aged and older women. For the fact, younger women can and do get breast cancer, as do men. So in 2017, about 4% of invasive breast cancer were diagnosed in women under age 40, while about 23% were diagnosed in women in their 50s and 27% in women ages 60 to 69. So while 4% might sound small, it isn't zero. So this percentage means that 1 in every 25 invasive breast cancer cases occurred in women under 40. So women of all ages need to pay attention to their breasts too. Okay. That is all for the facts and myths about breast cancer.
Okay, so to wrap up the session, okay, so breast cancer is a disease in which cells in the breast grow out of control. Risk factors of breast cancer include weight, diet, lifestyle, age of menarche and menopause, undergoing hormone therapy, and not breastfeeding or having children at the age of 30. Common types of breast cancer include ductal carcinoma in situ or DCIS, invasive ductal carcinoma IDC, lobular carcinoma in situ or LCIS, and invasive lobular carcinoma or ILC. Next slide, please. Some symptoms include some symptoms of breast cancer include new lump in the breast or underarm, or which commonly known as armpit, thickening or swelling of part of the breast, irritation or dimpling of the breast skin, nipple discharge other than breast milk, which includes blood, and pulling in of the nipple or pain in the nipple area. And there are different ways to diagnose breast cancer, which includes the breast exam, mammogram, or the breast MRI. And treatments include chemotherapy, surgery, or hormone therapy. Okay. So before we wrap up this session, I have a quote for everyone who is watching. So it's about focusing on the fight and not the fright by Robin Roberts. Okay. So I would like to thank everyone for participating with our discussion for our health advocacy campaign. So if you have questions, you can directly message our Facebook page, Women Bleed Pink, an advocacy for a breast cancer awareness campaign. Okay, so thank you everyone for participating, and stay safe, and God bless everyone.